We put together a brief triage training video to try to get everybody on the same page with how triage works. Hopefully after you watch the video, everybody can have a better understanding as the importance of the triage process. We're doing it consistently, we're communicating. So watch the video, I'll come in and make some other comments as we go. And after it's all done, I hope we're all on the same page with physician first, physician in triage, whatever we want to call it. And I appreciate your watching the video.
See a doctor today?
Yes.
Okay, so I just need a picture ID from you. We'll get you registered. Alrighty. Okay. What are the last four of your social?
1, 2, 3, 4.
Okay. And the reason for the visit today?
Abdominal pain.
Do you have any allergies to medication?
Yeah.
So on your wrist here, this indicates you have no allergies to medication.
Okay.
Alright, you can go ahead and take a seat. The doctor will be calling you for triage.
Now that triage process was ideal. It was about 30 seconds. We're not there yet, but we're going to work on getting a very quick triage process. Name, social security number, chief complaint, and any additional information that registration needs, we can try to get a little bit later in the triage process. So we're working on that. So, Marissa, your role.
I am RN triage number 1.
Okay, and you are working what hours?
Hours?
Yeah, how long are you here for?
7 to 7 p.m.
All right, good.
Dr. Raza, I'm going to be your triage number 2. I'm here 7 to 7. I'll be your feed RN if you're going to feed some patients.
Okay, Brandon.
Attack out the triage, taking patients back, drawing blood, collecting urine samples, doing EKGs.
Perfect. George.
George, I'm LVM, be starting IVs and blood draws and whatever else I can do to back up Brandon.
Perfect. Hermie.
Dr. Raza, I'm Hermie. I'm going to be a lobby manager and I'll keep you informed.
Good. And
Dr.
you are?
Raza, I'll be your captain today.
All right. Perfect, I guys. apologize for the quality of that little segment, but the point is, beginning of triage, huddle up, identify who your team members are, communicate when they're going to lunch, when they're able to pit patients for you or not pit patients for you, but just know who your team members are so it's not confusing for you.
My name is Rhoda. I'm one of the nurses. I'm just going to check your vital signs and ask you a few questions. Okay. So what's going on today?
Abdominal pain for the past 3 days.
Okay. Any other symptoms?
Dominant.
Diarrhea? Any fever at all? Just going to quickly check your temperature, then I'll ask you more questions.
Good morning. I'm Dr. Ramnas. I'm one of the triage doctors. Where are we in the story with?
Hey doctor, this is a 32-year-old patient coming with abdominal pain for 3 days, nausea and vomiting, no diarrhea, no fever.
Where does your stomach hurt, sir?
Right down the
Low
center.
there. Okay. And any trouble going to the bathroom, some diarrhea you're having?
First couple days.
Have you had previous abdominal surgeries? No. Okay. And any fevers that you're aware of? Okay. Well, I'm the triage doctor. What I'm going to do is I'm going to get some blood tests started. We're going to get a CAT scan, probably of your stomach, to make sure there's nothing serious. We'll have you wait in the waiting room until we have a bed available, and one of my colleagues will see you in the back. We're going to get the whole process going, so you're not waiting for anything else. Okay, any questions?
No.
All right. Thank you.
Good. All right. Okay, sir.
Good. Now, I know that encounter seems probably oversimplistic, but the point of it is it took about 60 seconds, and in the process, even though I didn't really examine his abdomen, was at least identify what we probably needed to get, but more importantly told the patient who I was, where he would wait, kind of what to expect, and that he would see one of our colleagues in the back. So I think that bit of scripting, identify yourself, let the patient know what to expect, let the patient know where to wait, but that things are going to be happening. Hello, sir. I'm Dr. Ramdas. I'm one of the triage doctors. I understand you've been having some abdominal pain. Give me a minute. I'm just going to look at the chart here so you don't have to repeat yourself. So you've had this for about 3 days and some diarrhea, and you've had no previous abdominal surgery. Is that correct? Okay. Well, your vital signs are good. You're not running a fever, but what we're going to do is run some blood tests. We're probably going to get a CAT scan of your abdomen to rule out anything serious. We will get a bed available in the back of our ER as soon as we do. In the meantime, we'll have you wait in the lobby, but we're going to start the whole process so you're not waiting for all this to happen. Okay? Thank you. Now, the point of that encounter is that if you are in the room without the nurse, have the nurse leave the screen open. You can walk in, look at the screen, save time, not have the patient repeat questions, and again, script it so the patient knows what's happening. When you're done with the patient, have them wait in the lab drawing area or just outside in the chairs so their name can be called, but don't leave them in the room. You've had abdominal pain for 3 days, you've had some diarrhea, it says you have a past medical history of fibromyalgia. Tell me more about your fibromyalgia. Okay, so I see you've got about a pretty good sized abscess here, but you know what, I think we can probably drain that out here. I know I harp on this, but use your phones and remember a few of the numbers that you may need to call just to expedite care of the patient. And finally, I know I didn't have the fast track PA and team involved in this video because we were just doing the immediate triage process, but once fast track is back out front, they'll be a big part of the whole triage process. So in conclusion, thanks for watching this video, and I know a lot of it was basic and it's nothing that you haven't done before, but I want to make sure everybody's on board with what we're trying to do. Thanks again.